Hi there, my name is Dr. Adora Uzodi, and I am a pediatric infectious disease specialist at Our Lady of the Lake Children's Hospital in Baton Rouge, Louisiana. In this video, I'm going to go over how to take a pediatric infectious disease history. If you're a medical student or a resident on your ID rotation, that is an excellent time to refine your history taking skills, and that's because ID physicians often take comprehensive history. So take advantage of that opportunity to improve your history taking skills and ask your ID attending for feedback. So the format that I'm going to show you is the format that I typically use to take histories. And as you can see, the outline is no different from the format that you use to take histories in general pediatrics or in medicine overall. However, you will see that we do lay emphasis on some sections of that format more than others. And you can use this outline for outpatients or for inpatients. So every history taking begins with asking what the presenting complaint is. And for a lot of ID patients, especially on the inpatient side, knowing where to begin to get that information can be daunting. A lot of our patients are complex and have multiple comorbidities. For instance, in the ICU, the patient might be critically ill, be requiring pressors, maybe on a ventilator, may have kidney injury and be on dialysis, and may have been there for several days or weeks, and you may not even know where to begin. So a useful tip is asking the consulting physician what the specific ID question is, and it may be something as simple as a urinary tract infection. So that sort of helps you stay focused on how to obtain more history. Even in the clinic, a lot of children that we see have multiple comorbidities, and the parent may report several complaints, and some of them may not even be ID related. So again, ask what the specific complaint that brings them to the ID clinic is. And you may find that in these complex patients, the ID question or concern is often simpler. So ask what the presenting complaint is, and if the child is old enough and able to participate in giving the history, by all means encourage them because that not only gives you a perspective, but sometimes it may uncover additional information that the parent might not have been aware of. So the next section is the history of present illness, and in this section you want to let the caregiver narrate the story in their own words, beginning from when it first began up until when you're seeing them. And for every complaint or symptom, you want to ask what the onset was, the duration, the severity, the course, and any factors that may have triggered or make the symptom better or worse. Ask what other treatments have been given, either at home or by other physicians, and ask if the child has had any similar prior episodes. In doing this, you want to let the caregiver narrate the story in their own words. We often discourage asking leading questions, but you can ask clarifying questions. So next is the past medical and surgical history. A lot of this information may already be on the EMR if you are in a facility that has an EMR, and all you may need to do is verify that the information that you're looking at on the EMR is still accurate. But if you are in a hospital that does not have an EMR, you may have to obtain this information directly from the parent. So number one, ask about the birth history. The birth history typically is not as relevant for teenagers depending on what's going on. For instance, if you have a teenager whom you're seeing for a urinary tract infection, asking or knowing that they had GBS in the neonatal period is perhaps not relevant. But it may be relevant for, say, a teenager who has been newly diagnosed with HIV, and you want to know if the parents are also HIV positive and the HIV infection perhaps was perinatally acquired. So there's an art to determining how far to go in knowing the birth history. And this also plays into the next point, which is asking about the previous infections and treatments received. You have to use your clinical judgment to know what is relevant to know at this time. Number 3, ask about previous admissions, particularly admissions for infections, surgeries, visits to the emergency department, and urgent care. Number 4, history of other chronic medical or surgical problems. This is almost always important for us to know in ID because these may be the reason they have the infection that we're dealing with, or they may influence recommendations to treat that infection. Number 5, inquire what invasive devices are present in the child. Number 6, ask if there were any issues with their recent preventive health visits, such as dental work or the need for glasses, because these preventive health issues may be risk factors for infections. For instance, recent dental work is a relevant risk factor for infective endocarditis. Immunization history. Review the immunization record for routine and travel vaccines. Again, this may be available on the EMR, and if it's not, you want to obtain the record, especially for children who are recent immigrants or adoptees. For children who are delayed or under-immunized or even unimmunized, ask the parent what the reasons for the delay is, because that gives you an opportunity to address any vaccine hesitancy or vaccine refusal. Drug and allergy history. Ask about current and recent medications. Ask why they were prescribed, who prescribed them, and when they were prescribed. Also ask or verify that the child is adherent to the prescription and they are taking the medication at the dose at which it was prescribed. Ask about allergies to food and medications. For every said food or medication allergy, ask what the symptoms were when it occurred. Ask what the onset of that reaction was relative to when the drug was given. The reason to ask these questions for food or drug allergies is because that helps you determine if the allergy is a true allergy and if that drug should be completely avoided or if it can still be trialed on that child. Family and social history. This is a section in the whole history-taking process where a lot of ID specialists do spend some time on for obvious reasons. So I'm going to go over the bullet points quickly. Sick contacts. This is obvious because a lot of infections are transmissible or contagious. So asking that question helps you make a diagnosis or even decide if there are contacts that may require post-exposure prophylaxis. And when you ask about sick contacts or contacts in general, you want to ask about contacts at home, but also contacts in school or even other children that the child may play with, or even other adults that sometimes babysit or watch the child. Animal contact. Again, important because many infections are zoonoses or diseases that are transmitted from animals to humans. And the right way to frame that question is to ask what animals the child has been around at home or at the homes of friends or relatives. Do not limit the question to asking about pets in the household, because sometimes some parents may not consider other animals in the house as pets and may withhold that information. Travel history, very important because a lot of infections are endemic or may be travel related. Water sources. Ask about the source of drinking water. For instance, well water may be a risk factor for gastrointestinal pathogens. Diet. Asking about their food choices or the source may give you more information on what the risk factors for an infection that you're dealing with is. For instance, unhygienically prepared food may be the risk factor for an episode of gastroenteritis. Some food choices have also been linked to some infections, for instance, unpasteurized cheeses and the association with listeriosis, or unpasteurized milk, or even improperly cooked beef and the link to E. coli. Hobbies and extracurricular activities such as camping, which can be a risk factor for histoplasmosis, gardening, which may be a risk factor for injuries from rose thorns, which has been linked to sporotrichosis, trips to the zoo, or animal exhibits, which also may be risk factors for zoonotic infections. Sexual and menstrual history, obviously important for determining if the teenager is at risk for a sexually transmitted disease. The menstrual history helps you determine what the LMP is, as this may be an indication that the female adolescent or teenager may be pregnant. And that plays into your choice of antibiotics because certain antibiotics are teratogenic and are contraindicated in pregnancy. The use of recreational drugs, alcohol, and tobacco may also be indicators of high risk behavior that may put a teenager at risk for HIV. Education and occupation are also important in helping you determine the next bullet point, which is a home environment and support system. These factors not only play into the child's socioeconomic status, which may put them at risk for some infections, but also may influence adherence to treatment recommendations. Family history of recurrent infections, death from infections, unexplained death, especially in infancy, and consanguinity are often more relevant in children who have recurrent infections, as these may signal an underlying immunodeficiency. And the last bullet, which asks about ancestry or ethnicity, are also important in infections that may have a genetic basis or primary immunodeficiencies. That question is also relevant in children who may have a periodic fever syndrome because some of those syndromes are more common in children with certain ethnic backgrounds. The final section in the format is a review of systems, which is self-explanatory. So I won't be going into much detail on that section, but as you know, this is where you ask questions about symptoms in every other system that is different from the system with the presenting complaint. And with that, we have concluded our history taking in ID. And one last tip, after I have gone over these 7 sections, I oftentimes would throw an open-ended question to the parent asking if there is anything that I have missed. And that gives them one last opportunity to jog their memory to see if there's something they have not told me. And with that, we come to the end of this video. And if you have enjoyed my video, please follow me on Instagram or Twitter, and do subscribe to my channel for more helpful videos on important infectious disease topics. Thank you.